All right, I'm Sergeant Edward Graves. I'm in the MedDet for the Delaware Army National Guard. My mission is support for the Delaware Psychiatric Center here in Newcastle. We are providing assistant care for one of the COVID-19 units here at the hospital, the only COVID-19 unit here in the hospital. They've had a lot of staff and patients that have been infected, so they're out. The staff are out of work due to that. So we're supporting their hospital mission, supplementing in so we can take care of the patient that they have. Yeah, I think we're stabilizing the unit that's going on due to the assistance. The patients here do have some mental disabilities in addition to healthcare issues. We have to kind of be wary of how we talk, how we act, and I think just our military etiquette and our military mannerisms is bringing a calmness to the staff and to the patients. We're coming in, we all have different backgrounds, so when we're coming in with some different ideas that maybe the staff here that are still here haven't yet thought of, and we're implementing some things that's maybe after we leave they might implement on themselves to keep things going in their units. The mission's important because we're actually helping people, and we're helping people in our state of Delaware. This whole COVID-19 thing has really put a lot of stressors on vulnerable elements of the population which are in this hospital or this center. And with us coming in, they're able to take care of these patients because these patients can't be out on their own currently, with their disabilities that's going on. And even though they're not critically sick, we are doing everyday patient care. We do some changing of the patients that aren't mobile. There's a few patients with dementia and things like that, so we have to feed them. They can't feed themselves, and then we're just doing anything we can to help them and the staff to get with their day-to-day living, making a difference. Well, we're with the lack of staffing here, pretty much our unit that we're working at, they've lost, not to know the exact numbers, but maybe over 50% of their staff. So the staff here, they get mandated to work 16-hour shifts. They don't know that until literally an hour before their shift ends. And they're working double shifts 5 days in a row, some of them. So with us coming in to give them a little bit of assistance and know that we bring a competent workforce to the unit, I think it's settling for them. Okay. I've been in the National Guard for 20 years. I've always been a medic. Well, I've been deployments, been to Saudi Arabia for Desert Spring, Operation Desert Spring. For the troop surge, I was stationed in Kalsu, Iraq, and then Afghanistan in 2013. We've also done some humanitarian type missions in Georgia and Puerto Rico, and other support has just been for our natural disasters that we have, snowstorms, hurricanes, things of that nature. Well, with Georgia and Puerto Rico, we did baseline assessments of patients, and I was teamed up with a provider. We did basic vital signs, got a past medical history, and if there was any sources or resources that we could send them to, depending on where we're at, we would send them to those sources such as dental, and things of that nature. We also got some good training in just communicating, especially in Puerto Rico with people that speak a different language than I do. So that was exciting for me to get that done. For Georgia, it's just helping an element that needed the care at the time. And the same as Puerto Rico for both of those. In Iraq, we were setting up a police station, and we had the surveyor. Our team was out with surveyors, and we're putting protection out on the roadway. And a truck comes speeding up to our convoy, once he stopped, we found we had an injured civilian in the back, which had his leg and his arm amputated. And what we could gather with our interpreter was that it was because he stepped on a pressure plate IED. So we initiated care and put on tourniquets, and we CASEVAC'd them out to one of the local COBs. I was the only medic on the scene, and then I had some combat lifesavers. First Sergeant Ashby was with me at that time, Sergeant Ashby at that time, and he was a big assistance to us. And then just the support we received to get him loaded up on the litter and in the care. It made me feel good because we, as the medic, this was with the 153rd MP Company. We did a lot of training with my platoon on just that type of incident, and everybody worked out great. So for me, it told me that the training that we're doing, they were able to comprehend, and also in the time of crisis, they were able to complete their mission and do patient care without freezing up. Well, with my deployments and those experiences, you get to good experience working with people of different different backgrounds, cultures. And it's the same here, even in the state. We have a variety of people and cultures that we have to deal with. Also, being able to work under stress, compared to being deployed, this is pretty simple. So what a lot of other people might think is a little more intense or more draining on their motivation to work. Being high tempo with those deployments, it's kind of prepared me for that. Well, I have two jobs actually. I'm an EMT for Nemours AI DuPont Critical Care Transport Team, and then I also work part-time at the American Legion Ambulance in Smyrna. Both of them have been affected by this, pretty much from Nemours, I go around to surrounding facilities and we pick up sick children, and we bring them to our facility for more specialized care. Yeah, I've worked at Nemours for a total of 9 years, and I've worked at the American Legion Ambulance for 5. I'm a EMT for the Critical Care Transport Team. Well, we staff ambulances for the hospital. We go to all the local surrounding facilities, probably in about a 200-mile radius, and we pick up children that require specialized care. We also do a lot of the neonatal transports, and pretty much any hospital that feels uncomfortable with a pediatric patient, they'll usually call us for our guidance and leadership, and then we will, if need be, come and pick them up and bring them to our facility for a higher level of care. Both of them are very supportive. Both organizations are military friendly. For me, I always try to keep my supervisors in the know of what's going on. So when COVID-19 started heating up, my unit was passing down information to us, weekly, and I was letting them know, possibility of deployments or activations, and pretty much by the time that it came up for this activation, they were already planning for me to be gone. So it was good. Oh, can we? It was. They were fine with it. I'm sure I'm missed, but they understand that I like being in the National Guard, and it's what I like to do, and that I'm out there doing something that's helping. Well, I think there's a good collaboration because not only with the Army National Guard, we have the Air National Guard with us as well. So we get to work with them, and we're all in the military, but we're all working different tempos and different elements, and it's good to see another side on how they operate and how I can implement that into how I operate my mission. In this together means to me that we're all together to help each other and to get through this as safely and as smartly as we can. Well, my nurses rock everyone I work with, so they're dedicated to their job. Don't let them all know that because their ego gets a little bigger, but that's just part of the job. Now I'm glad to have the opportunity to serve my state, and this is one of the reasons why I joined the National Guard. I know a lot joined for college and other things. I joined to serve, so I'm glad that I can be a part of that.